The presentation this morning was about new therapies for osteoporosis. In the last 20 years, a whole variety of drugs have been approved for treating osteoporosis with different mechanisms of action, and when the right patients are treated, those drugs are actually very effective in reducing the risk of spine fracture and hip fracture. Despite, though, having those new drugs, the proportion of patients with osteoporosis in the United States and in other parts of the world that are being treated has, interestingly, progressively declined over the last several years. Part of that is because there are concerns about rare long-term safety issues, particularly with bisphosphonates. That, as a limitation for therapy, coupled with the inconvenience of the dosing of oral bisphosphonates or the subcutaneous injections, and the fact that none of our current treatments cure osteoporosis and normalize the situation, all of those open the door for new therapies that can be brought to bear. There are three therapies in the late stage of clinical trial. One is abaloparatide, a synthetic derivative of human PTHrP, and phase 3 studies have again documented that it is very effective in not only improving bone density but reducing fracture risk. The second drug is odanacatab, a cathepsin K inhibitor that has a totally different mechanism of action, inhibits bone resorption, but does not inhibit bone formation, resulting in progressive and continuous increases in bone density over 5 years' time. The top-line fracture data have been presented but not yet published. It suggests that it would be a very appealing drug for many patients with osteoporosis. And then lastly, romosozumab, an inhibitor of sclerostin. Sclerostin is an inhibitor of bone formation. So by inhibiting that inhibitor, new bone formation is stimulated. And the effects in animals are really dramatic. The effects in patients, again, have been quite substantial in terms of increases in bone density. And the very top line fracture data have been released in a press release, but not yet presented. So I reviewed all of those new drugs and why we need them, and perhaps where their roles might be in the future treatment of patients with osteoporosis.